Boris Johnson is keeping a very close watch of the latest coronavirus situation amid demands for rules to be reintroduced due to a surge in infections. Downing Street admitted the coming months would be challenging, but that while current statistics were broadly in line with modeling done by scientists earlier this year. Last month, Mr. Johnson unveiled his Plan B for tackling the pandemic if a rise in cases and hospitalizations risked overwhelming the NHS. The backup plan included reintroducing coronavirus rules such as face masks in indoor settings. Mr. Johnson is coming under increasing pressure to reimpose rules to combat the spread of the virus. The Prime Minister's official spokesman said, "We obviously keep a very close watch on the latest statistics and we always knew the coming months would be challenging. What we're seeing is case rates, hospitalizations and deaths still broadly in line with the modeling as set out a few months back now. The vaccination program continues to be our first line of defense, along with new treatments, with testing, with public health advice." Education unions are demanding a return to school bubbles and face masks in classrooms for the winter months. While some scientists are pushing for face coverings to once again become a requirement in indoor crowded spaces. 5 education unions wrote to Education Secretary Nadeem Zahawi last week urging him to once again impose rules after official figures showed children had the highest COVID positivity rate for any age group. The National Education Union accused the government of standing by while COVID cases surge across schools. General Secretary Kevin Courtney added, "It is evident that more needs to be done, and sooner rather than later. To prevent further massive disruption to children's education, caused either by children contracting COVID-19 or COVID-related staff absence." Meanwhile, Professor Susan Michie from University College London, who sits on the SAGE board advising the government on COVID, said more needed to be done to reduce infection. "We need to keep people out of the health service," she told the newspaper last week amid fears of the NHS becoming overwhelmed. "We keep them healthy by taking more measures to reduce people's risk of getting infected.